Today, we will explore an interesting topic about time management and the rights of nurses in the hospital environment. Our story will take an unexpected turn when a head nurse suddenly demands strict adherence to contractually mandated break times during night shifts, prohibiting additional breaks, even though nurses had previously used this time to rest after busy daytime shifts. If you find this story interesting and full of valuable lessons, don't forget to like, share, and subscribe for more inspiring content. In the past few years, I've experienced the journey of being a nurse, a challenging yet incredibly meaningful profession. In the early years of my career, I worked in the emergency department of a small hospital in Canada. This hospital handled basic admissions, standard surgeries, and moderate special care. However, patients with severe conditions requiring cardiac surgery or intensive trauma care were transferred to larger hospitals in the city, where modern equipment and specialists ensured optimal care. We served a small community, and the hospital only had enough staff to perform essential functions. This meant that each nurse had to manage more patients than nurses in larger hospitals. Fortunately, the severity of cases here was lower, which helped balance the workload somewhat. However, this balance wasn't always maintained, especially during peak hours. Late mornings and the beginning of night shifts were extremely stressful, with patient numbers spiking and tasks piling up. However, by the end of the night shift, when patient numbers decreased significantly, we often had enough staff to manage tasks easily. Interestingly, even with fewer staff, shifts ran smoothly during these hours. Yet, management never considered reducing staff during low patient periods, likely due to potential risks. Another challenge was the lack of replacement staff during breaks. With limited staff, there was no one to substitute when a nurse took a break. Therefore, if a colleague took a break, the remaining nurses had to handle double the patient load. While this wasn't as stressful during the night shift due to a lighter workload, it became a significant issue during the day shift. Nurses often missed their unpaid 30-minute break at the end of their shift because of the heavy workload, a common and not easily solved problem. Our work structure was also noteworthy. We worked in teams, each consisting of an emergency nurse, trained to handle complex situations, and a med-surg nurse, experienced but awaiting further training to expand their care scope. Coordination between teams was crucial, especially in sharing information and reporting patient status. Instead of each nurse reporting on 4 to 5 patients they directly managed, teams would handle reports for 8 to 10 patients, doubling the reporting time and adding pressure at the end of the shift. Our union plays an essential role in protecting the rights of nurses, especially against wage theft, a not uncommon issue in healthcare. After tense negotiations, we reached key agreements. Nurses could request compensation for the 30-minute unpaid break with a pay rate of 1.5 times the normal rate if they missed their break. This was especially helpful since nurses often missed break time during busy day shifts of a 2-day/2-night cycle. Additionally, we were paid an extra 15 minutes for each hour worked beyond a 12-hour shift. This situation occurred almost daily due to extended handover times. Not everyone was satisfied with these agreements. Hospital management reluctantly complied but was clearly unhappy with the additional salary costs. However, for us, nurses working under high pressure and tight schedules, this wasn't just about reclaiming our legal wages, it was about affirming the value of our labor and creating a more equitable balance. In the quiet night shifts, an unexpected aspect emerged. With the significantly reduced workload and only one emergency doctor handling cases, nurses often took advantage of this time to rest for 30 to 45 minutes. This short break helped recharge and compensate for 1.5 to 2 hours of lost wages during busy day shifts or extended handovers. Surprisingly, even with fewer staff during the night shift, work proceeded smoothly due to the lower number of patients and the primary tasks awaiting the doctor's direction. However, management maintained staffing levels unchanged to minimize potential risks. A flexible communication system ensured safety in emergencies. During short breaks, nurses would leave contact information so colleagues could call them back if immediate assistance was needed. In emergency situations or special cases, we were always ready to return immediately. Of course, in extremely busy shifts with complex cases, we would strictly adhere to the allowed break times or skip rest entirely to focus on patient care. Overall, these measures balanced nurses' rights with their job requirements while maintaining physical and mental health in a challenging work environment. This approach not only benefits individuals but also enhances the quality of healthcare services, ensuring patient safety and treatment effectiveness. Initially, things seemed smooth in the early years I worked here. The system ran well, benefiting nurses and helping management, and indirectly the government, save significant costs on wages by reducing staff numbers. This efficiency was critical in the public healthcare system, where resources had to be allocated meticulously to meet the growing needs of the community. During this period, patient care was unaffected, and care standards were maintained. The nursing team could take advantage of additional breaks during night shifts, a practical, unofficial approach to recharge. This not only improved physical health but also helped maintain mental stability in a role requiring intense focus and the ability to adapt to emergencies. Moreover, these short breaks played a crucial role in reducing stress during the shift change between night and day, a familiar challenge for those working in healthcare. The mismatch between natural biological rhythms and rotating work schedules often led to prolonged fatigue. However, these flexible breaks made transitions easier, helping nurses adjust to schedule changes and maintain stable work performance. Looking back, this was a rare period of balance. Nurses felt supported and comfortable at work, while the hospital and healthcare system benefited from clear improvements in operational efficiency and cost savings. This harmony, although not formally recognized, created a work environment where both staff and management felt satisfied, at least in the early stages. My story begins when I noticed a sudden change in the work environment, and immediately, I found myself thrust into an unprecedented stressful situation. One morning, as I was preparing for my shift, an email from the hospital management was sent to all staff, announcing that break times would be shortened, with only 60 minutes of unpaid break and 45 minutes of paid break. My first reaction was one of indignation, because those breaks had become a lifeline for me to recharge after long, exhausting shifts, and now they were being reduced. I knew immediately that this wasn't an easy decision but a response from management to a few employees who had abused the privilege of extended breaks. However, after some thought, I realized that this policy also had its reasoning, especially considering that some individuals had exploited the break time for unreasonable extensions. That's when I decided not just to stand aside but to take action. My colleagues and I began to delve deeper into the rights outlined in our employment contract, recording every missed minute of break time, and filing requests for compensation. This wasn't just an act of protecting our rights but also a fight for fairness in a high-pressure work environment. In the 2 weeks that followed, I resolutely adhered to all the terms of the contract, not skipping a single minute of break, and not accepting overtime without proper pay. Gradually, I noticed that it wasn't just me, but the entire medical staff began to have a new awareness of their rights. The brief breaks not only helped us recover physically but also kept our minds sharper during shifts, improving the quality of our work. Eventually, management had to admit that this change was necessary. They agreed to our demands and committed to supporting proper rest periods to maintain staff health. What satisfied me most wasn't the extra money on my paycheck but the peace of mind that came from being able to get proper sleep between night shifts. Looking back at the journey, I realized that work is not just about giving your all but also about understanding your self-worth, protecting your rights, and continuously striving to improve the work environment. In the end, I understand that perseverance, listening to your body, and standing up for what's right are the keys to overcoming any challenges in the profession. In regular inpatient units, head nurses work fixed hours from 8 a.m. to 4 p.m. on weekdays. When they're not available, the nursing team often substitutes for them. However, in the emergency room, with its urgent nature and fluctuating patient flow, the role of the head nurse is much more complex. Here, the role is taken on by experienced emergency nurses on shifts, who receive a small wage increase. This ensures that even without a full-time manager, the ER is still overseen by capable individuals who can handle pressure and make crucial decisions. However, this also means that head nurses face high stress during each shift, as every situation requires quick thinking and high responsibility. One morning, just before my shift was ending and I was preparing to hand over, an unexpected email from management was sent to all staff. The email announced the strict enforcement of contract regulations regarding break times during night shifts. This meant that we could only take a maximum of 60 minutes unpaid break and 45 minutes paid break. My first reaction was discomfort. However, upon further reflection, I understood that this decision might have a valid reason. In fact, a few nurses, though rarely, had exploited the previous system by unnecessarily extending their break times. For example, there was a case where the head nurse took a 3.5-hour break during a night shift, regardless of the workload. This not only caused dissatisfaction among the staff but also raised questions about patient safety, especially during the early hours of the night shift when the workload tends to be higher. Although most nurses disagreed with such behavior, it left a bad impression, prompting management to take action. However, it's important to note that most emergency room nurses are not lazy or exploitative. Most of us enter this profession with a strong sense of responsibility and dedication. Instead of seeing extended break times as a way to escape work, we view them as a reasonable solution to recharge, especially when the job demands high physical and mental exertion. This policy change was not just a decision from management but also highlighted a deeper conflict between the practical needs of nurses and management's perspective on work time management. It sparked heated debates among staff, from young nurses just entering the profession to seasoned veterans, marking the beginning of a series of shifts. When the email was circulated, it immediately became a hot topic in our group chats. News spread quickly, and young nurses, especially those from the millennial generation, familiar with labor rights, acted immediately. They began reviewing the contract closely and utilizing every clause to protect their rights. These young nurses not only recorded missed breaks and extended handover times but also proactively educated older colleagues about their contract rights. This spirit of solidarity and initiative sparked a wave of change in how we approached wages and benefits. That day, I decided to forego my last break and stay an extra 15 minutes after my shift to complete the report. This resulted in an additional $50 on my paycheck, a modest but meaningful amount in the context of the public healthcare system needing to save costs. When I submitted my overtime request, OT, for approval, the head nurse seemed surprised. However, I simply explained briefly that I was following the regulations to ensure there were no payroll errors. In the next night shift, a sign-up sheet appeared at our work area, requesting us to record the start and end times of our breaks, along with a contact number. This was explained as a measure for management to call us back if needed, although the employment contract required that such calls be compensated as overtime. Moreover, the on-call status, which usually comes with a $4 per hour allowance, was completely disregarded. When asked to leave a contact number, I refused, emphasizing that I would only return early in an emergency situation like a code blue, a medical emergency involving cardiac arrest or loss of pulse. I also reminded them that the code blue announcement is made publicly through the PA system, so calling individual nurses was unnecessary. In the following 2 weeks, I steadfastly adhered to every term in the contract. Every missed break and every extended handover minute was recorded and submitted as required. During night shifts, when the workload decreased significantly, I often finished my work early and spent the remaining time waiting for instructions from the doctors, sometimes just browsing through my phone. However, leveraging the contract regulations brought a notable benefit. Full-time nurses could earn an additional $2,000 per year simply by requesting overtime payment. This was a significant income boost, especially in the context of the constrained public healthcare budget. Eventually, management recognized the situation and restructured the process. They announced that although they were willing to approve any overtime requests we submitted, we could still take breaks late at night as long as we left a contact number. This request was seen as a compromise to maintain work flexibility while easing pressure for both staff and management. Carefully, I requested that they send this notice via email as proof. Although I could have escalated the issue to the union representative to apply more pressure, I chose not to. My goal, to restore reasonable breaks, had been achieved, and I saw no need to prolong the conflict. After leaving my previous job, I secured a position at a larger hospital, and the experience from the past 2 years truly brought me more satisfaction. The new workplace provided me with a sense of comfort and support that I had never experienced before. One of the biggest changes was that I no longer worked in the teamwork model. Instead, a dedicated nurse now took on the shift, ensuring that my colleagues and I always had enough time to rest. This change not only reduced stress from lack of breaks but also created a more efficient and professional work environment. Moreover, my current hospital actively encourages longer breaks when possible to prevent burnout, a common issue that I and many of my colleagues had encountered in previous years. This is not just a policy change but also reflects management's genuine concern for the mental and physical health of the staff. This awareness has taught me that care should not only be for patients but also for the healthcare workers who give their all day and night. Even now, I continue to monitor missed breaks and extra rest time to ensure compliance with the terms of the employment contract. This practice helps me accurately track my rights and reinforces my belief that my efforts are valued. Notably, my new hospital is more than willing to approve missed break requests as a way to support staff retention amid the widespread nurse shortage. However, I realize that I don't need to exploit this policy. My professional conscience doesn't allow me to take advantage excessively, especially since I am now assured of a balanced and stable work environment. Honestly, what satisfies me most is not the numbers on my paycheck but the sense of peace that comes from getting proper sleep during night shifts. For me, sleep is not just a biological need but also a symbol of improvement in my working conditions, a huge step forward from the stressful and exhausting days in my previous job. Looking back at my journey, from the stressful days in a small hospital to the positive experiences in a new environment, I realized that work-life balance is not just a desire but an essential factor in maintaining health and passion for the profession. The challenges in my old workplace taught me the value of solidarity, the importance of fighting for rightful benefits, and the power of perseverance in protecting my mental and physical health. At the same time, the experience at my new hospital has shown me that a supportive, respectful, and encouraging work environment not only enhances performance but also builds trust and long-term commitment. The biggest lesson I've learned is that working hard is not enough, we must also work smart. Listening to our bodies, protecting our rights, and finding harmonious solutions are the keys to managing stress in any field. Most importantly, regardless of the circumstances, we must maintain our professional integrity because it defines the true value of ourselves and the work we contribute. In work, especially in high-pressure environments like healthcare, standing firm on principles and protecting one's rights is incredibly important. However, this must be done wisely and reasonably. Don't get swept up in unfair changes without thoroughly understanding and fighting for your rightful benefits. At the same time, maintaining a balance between work and life is essential to preserve health and passion for the profession. Don't just focus on working hard, but work smart, listen to your body, and protect your health. In fact, respecting personal rights will create an effective and sustainable work environment, not only for yourself but also for the collective.